Let's take you back to one of our leading stories now, and we continue our coverage of the signing of the National Health Insurance into law. Let's speak to the Minister of Health, Dr. Joe Phaahla. Minister, good evening to you, and thank you very much for your time. It's been a busy day for you. So let's begin with what is current right now, and those are the threats to take the NHI to court. And so, when is it that ordinary South Africans will start experiencing the benefits of this NHI in the midst of the legal processes?
Well, thank you very much. Thanks for having us on your program. Well, the threat of legal action don't start now, even while the process in Parliament at various stages, whenever there were some disagreements, we would be informed by colleagues in the committee that there have been some threats, and they will then again get together. But I can also just indicate that early this year, in fact, starting from late last year, we were taken to court by an organization called Solidarity Union, questioning why we had created an NHI branch where we are starting already to make some preparation on some of the work, but also some of the projects which in any way would improve the services. And we went to court. They lost on urgency late last year, and then they were given an ordinary court date in February. There was an argument in court, and the court ruled in our favor that we can proceed because this is an approved policy, and also that we are working within the provisions of the Public Service Act.
Yeah.
So we've been there. We just hope that even the current threats, we would be ready, therefore, to engage with the aggrieved parties in the courts. But our hope is that while that battle will continue, we will be able to put in place the necessary mechanisms. As we have said, we have got two phases, and that we now that the act has been signed, we are already on the first phase.
Yeah.
And we will be on the second phase in 3 years' time.
All right. Professor Abdul Karim, this is someone you know very well. You worked closely with him during COVID. He holds the view that it's actually a good thing that this be taken to court in order for it to pass legal muster. Do you agree with him?
Well, it's neither whether I agree or don't agree. I mean, I think what Professor Salim is basically also echoing is the fact that, we acknowledge that we are in a constitutional democracy. And as I said in the media briefing today with the president, that we acknowledge that South Africa is a constitutional democracy, and there's a whole lot of what some people call lawfare on almost even small issues, including family disputes. So on a big matter like this, which has a possibility of really changing a number of ways in which many people have been accustomed to doing things, it's not surprising. And therefore, we should acknowledge that it's within the rights as enshrined in our constitution, and we'll engage at that level. And in a way, Professor Karim may be correct that maybe that kind of argument in the courts, as is the case with many other issues, will settle the matter.
All right. So I think in not so many words, you do agree with the professor.
I would have wished that it wouldn't be. Totally. I think in the same way as, sometimes even the courts, in South Africa, too many issues end up in court, even disputes on traditional leadership, even religious bodies end up churches. And sometimes even the courts end up saying, we want to give you time to go and try and settle. One is measures, social rights, which is within the Bill of Rights, as in Section 27 of the Constitution. One would have wished that there would be no need, that we would be united and have a smooth, implementation. But I would say I'm not necessarily agreeing to say it's the best thing. But since it is there and it is within the kind of constitutional framework of our country, we acknowledge it, and we're going to be we're going to be participating as we should be. So we'll be ready.
Legal issues aside, Minister, there is a South African who's watching our conversation this very minute, and they are simply wondering when it is that they can start experiencing the benefits of this NHI. And I'm saying this on the back of statements such as those made by Panyaza Lesufi not so long ago. He's the premier of this province, putting a particular date that after the signing, you can go to any hospital you want to in South Africa and they will not chase you away. Is that indeed what is going to start happening from today?
Well, I did get a hold of a video which indicated that, and we did inform the Premier that that's a very wrong understanding, and he accepted that. That's never been expected. That I think somehow, whether he might have been, just taken away with the excitement of the future, what it entails, but not in the immediate. That future is not tomorrow. We have said very clearly, and if you even read in the act itself, now that it is an act, it does put time frames to say first 3 years, 23 to 2023, 2026, first phase, preparatory, setting in place the institutions, strengthening the health systems, putting all the necessary infrastructure in terms of information systems, all the other key, policies of making sure that in another 3 years, but what it also says is, and which is what we're working on, and that's why when we're taken to court, we're able to show that it's necessary to make those preparations. So what it indicates also is that within even the first 3 years, we have to look at possibilities of a certain package of health services which many people are not able to access, bring in some of the health professionals into free services. And especially for vulnerable groups who may not be accessing. Just give you an example, many people don't access eye care, care of their teeth, hearing, and various other key primary health care, which are not currently available in clinics except in private, through private services. So we envisage that certain basket, even in the first phase, they will start to be accessed by a certain section of the population.
Dr. Phaahla, I've only got 2 minutes with you. Please, I'm going to ask you to be brief in the next 2 questions. Critics and observers alike are saying that the first phase of NHI, these were the pilot projects, they are saying all of them failed. If government is going to be the key driver of this NHI, do you agree that the biggest impediment to implementing NHI is the trust deficit that exists against government?
Well, firstly, let me just say quickly that there is a report on the performance in terms of the mandate of the pilots, because there were very clear parameters in terms of infrastructure, in terms of contracting certain health professionals, in terms of improving certain aspects of health information services, including distribution of medicines and so on. There are various elements. These were not meant to be testing actual access to prepaid services, because that's what ultimately universal healthcare is about, that we need to pay upfront through whatever means so that nobody has to pay at the point of care. This is the only time. So those lessons have been learned and are now actually being rolled out as we speak. just on the health information, we were quite advanced in rolling out an electronic medical record system, which will include even biometric, and almost more than 60 million people have already been recorded in that system. Just to give you a tip of some of the areas which were part of the pilots, we acknowledge that the communication was probably not very much up to scratch, and there was a fault to ourselves that the message maybe in some way was not clearly understood. Now that the act is there, that's the only time that you can actually start to put in the institution, which will actually make it possible to do the kind of universal coverage at the point of care.
All right. Well, I think, Minister, what you are essentially confirming here is that, as you say in your words, lessons have been learnt. So you don't necessarily disagree with the notion of the failure of pilot projects. But let me conclude.
No, I disagree. I'm saying to you, there's an independent report which is available, which we can make available.
All right.
Which disagrees with that, yes.
Minister, I'm going to have to leave it there. I'm completely out of time. I would have wanted to know where is the 300 billion going to come from, but we'll save that for another day. Dr. Joe Phaahla, Minister of Health. All right, Dumisang Ndlovu standing by with your